Okay, so we'll go ahead and get started. Hi, everybody, and welcome to today's webinar, where you will get a sneak peek look and a better understanding of ACH's ENRICH Healthcare Communication course. The theme of the ENRICH course this year is Nurturing Resilience, Communication Skills for Building Healthier Organizations. This webinar is hosted by the Academy of Communication and Healthcare, and my name is Rachel Porch, and I'm the project coordinator here at the Academy. ACH is a nationally based nonprofit organization. And if you are not a member of ACH and would like to benefit from our recorded webinars as well as many other valuable benefits, we would like to invite you to join our community. And feel free to visit our website there that's linked on the screen. ACH hosts annual events, and our next upcoming event is the ENRICH Healthcare Communication Course and Research Forum, which you will learn more about today, so I won't reveal too much detail. However, I do want to note that this event is a co-located program where clinicians, educators, researchers, and applied healthcare professionals all interested in healthcare communication gather. And today you'll be learning about the ENRICH course portion, whereas the forum portion features presentations on the latest research and teaching methods, and there's currently a call for abstract submissions out for that right now, and more information can be found on the event through that link there listed on the screen. So as we segue into our actual presentation, I would first like to practice using the chat box, which some of you have already found, which is great. That's there on the bottom right-hand side of the screen. And since you, our participants, won't have a vocal voice here during the presentation, this is where we would like to invite your questions and comments. So if you would please locate the chat box there and answer the question here on the screen. Are you planning to attend the ENRICH course? And if not, what are the most important barriers? And we'll give you all a second to respond there. Awesome, Sharon. Well, we hope to give you more information. It looks like some people are on the fence here. Great. All right, well, we are glad that you have joined us, Kevin, to hear more about it. Okay. So thanks again, everybody, for participating in that little exercise. Again, if you have any questions or comments throughout, you can type them in there, and then we will leave some time at the end to answer questions. So moving forward, I would like to begin my handover here to Dr. Tim Gilligan with a short introduction. Dr. Gilligan is a medical oncologist, vice chair for education, and associate professor of medicine at the Cleveland Clinic Taussig Cancer Institute. He's director of coaching at the Cleveland Clinic Center for Excellence in Healthcare Communication, which has trained over 5,000 clinicians in a one-day small group experiential communication skills course. At Cleveland Clinic, other hospitals, and international conferences, he teaches communication skills, team building, and coaching, and trains others to teach communication skills. He also coaches clinicians working on communication and interpersonal skills. Dr. Gilligan is the course director for the ENRICH course, and we're excited to have him here with us today. And Tim, I will now pass the presentation over to you.
Great, thank you. So thanks everyone for joining the webinar. It's my pleasure to have an opportunity to tell you about ENRICH and why I have found it such a helpful course to go to myself. I started going, I think it was in 2012 when it was held in Minneapolis, and I've actually gone every year. This is the second time I've been course director. In the interim, I went through training to become faculty in the organization of ACH. I wanted to talk a little bit about what ACH is. As you heard, I spend a lot of my time teaching communication skills, doing conflict resolution, coaching people, and I'm really interested in how we get people to work together more effectively, simply from a quality perspective. Many of the medical errors and shortcomings in our healthcare system are traced back to failures of communication. And the Academy on Communication and Healthcare is really trying to work on that issue in a variety of different ways. I think it's also important to know that there's a strong community within ACH, and that's partly what makes ENRICH a different experience. So we're going to talk at the second half of this webinar about how ENRICH is structured and what the content is. But a lot of the content that we cover is also covered in other places, and I think what's different about ENRICH and what's been different about ENRICH for me is the way it's done, the forms that's used, the kind of community that's there, and an opportunity really to learn not just some skills that I can practice, but a better understanding of myself, how I get along with people, where I tend to get stuck, what helps me get unstuck, and how I can go back to my day job when the course is done and be a more effective version of myself and how I work with other people. In terms of sort of our language about ourselves, ACH is the professional home for all those who are committed to improving communication and relationships in healthcare. And that's really, I think both these words are very important. How do we communicate more effectively so that we understand each other more effectively? And how do we build stronger relationships? Because if we have trust and a strong relationship, whether it's with patients or colleagues or the people we supervise, the people we report to, if there's a strong relationship, everything else that we're trying to do is much easier. When there's mistrust or misunderstandings, it generates a lot of friction and unnecessary mistakes and conflict and things like that. And what's been striking to me about in this work is that if I go around and shadow doctors and talk to people about the challenges they're having, I find that almost everybody has important conversations that they know they need to have that they're not having, or they're not having in a way that's effective and gets them to where they want to be. So then the challenge is, how do we do better? And for me, I also look at this a little bit from a global perspective. What I am tasked with at work and what we talk about a lot at the ENRICH course is how do we communicate more effectively at work. But the skills for building effective relationships and communicating effectively with each other transcends every moment of our lives, that we're not alone, really. And I personally think that communicating with each other is much harder. If we look around the world, there's an incredible amount of conflict and discord. And I'm not saying that communication skills would solve all of that, but certainly the communication that we see in the world is inadequate. We see a lot of adults behaving in ways that predictably result in outcomes that they don't want. And so the challenge with communication training and building stronger relationships is, if we're getting outcomes that we don't like, are we willing to invest in ourselves and our skills and change our behavior so that we can get different outcomes that we're happier with? I think that we are much farther apart from each other than we like to think that we are. We have a lot of imagined closeness, but again, I go around and talk to people, and there are important things people have to say and important conversations that they have to have that they don't know either how to have the conversations, or when they try, they don't go well because they're not doing it skillfully. And so we talk about the local sports team, and we talk about the weather, and we talk about the parking. But if you talk about the weather in Cleveland, nobody likes bad weather. So if you tell me you don't like bad weather, I haven't learned anything about you. And we find ways to talk about things that really matter to us, what we're struggling with. If there's conflict between us, can we talk about that conflict constructively? I bring up conflict because conflict is actually an opportunity to have a really honest conversation. And if we have that conversation well, we actually end up really understanding each other a lot better. If we have that conversation poorly, we end up pissing each other off and being more distant. So how do we get closer is an important issue for me. This is a quote from the book When Breath Becomes Air by Paul Kalanithi that I know has been very widely read. Perhaps you've read it. But as an oncologist, it really spoke to me. Serious illness wasn't life-altering, it was life-shattering. It felt less like an epiphany, a piercing burst of light illuminating what really matters, and more like someone had just firebombed the path forward. The reason I included that here is that in the healthcare environment, we're often dealing with extremely high-stakes situations. We're seeing terrible things happen to people, terrible illnesses or consequences of treatments gone awry, and that carries an emotional burden. And recognizing that our world is not a normal world. Most people don't see stuff like that. You know, I think firefighters and police officers see carnage just like we sometimes do. I think priests deal a lot with helping people cope with horrendous loss, and that's similar to us. But a lot of people have jobs where they don't need to deal with this kind of stuff, and I think it's helpful to keep in mind that we have special challenges in healthcare, and if we can work on our skills, it really can help us navigate what is a treacherous terrain at times. One thing that's been really helpful for me is to separate what's emotional and what's cognitive. Many of us who work in healthcare have a strong cognitive bias. We think that the solution to problems is ideas and facts and arguments. If we just marshal enough evidence, we'll carry the day. And yet our experience as human beings is largely emotional in how we feel. And if we ignore that, then we don't really understand what the people around us are going through. If we respond to their emotion with facts, for me, it's like giving a really thirsty person a hot dog. Hot dogs are nice, but they don't quench your thirst. And when you're upset or angry or sad or whatever, information isn't usually helpful or as helpful as empathy. This cartoon here tries to summarize this. This is from the New Yorker. Death has come to apartment 3B and is giving a save-the-date card to the occupant and telling him not to freak out. This really resonated with me as a doctor because I feel like I see this happening. Patients are told how to feel. They're upset. They're told not to be upset. It's not as bad as you think. Don't cry. Telling people how to feel isn't very effective. If I'm really upset and you tell me not to be upset, it's hard for me to suddenly get less upset because you asked me to. An alternative response to this is empathy. The other thing is it's just not effective. You can see the occupant is still freaked out. I think that's really the point of the cartoon. But we can do better than that with practice. It does take practice to learn these skills. If we're going to be empathic, if we're going to address emotion, we need to be sincere about it. People can see through phoniness. This is what I would call the human relations version of empathy. I'm sorry your head hurts, sweetie. Is there anything I can do to make you shut up about it? Can we show sincere caring and not have formulaic words that don't express how we really feel? The issue with empathy and emotion is not to sound as if we care. It's to show that we care. Hopefully we really do. And how do we express that so people can hear it? When we try to fix their problems and tell them not to freak out, like in the prior cartoon, that doesn't really help. There are skills we can learn to be more effective. And then the other thing is just, can we be clear? There was a study of American hospital patients that showed that only half of them could name the doctor in charge of their care, and only half of those who could were correct. There's chaos in the hospital from the patient's perspective. They see 3 different people and are told 3 different things, and that creates a lot of mistrust. Can we learn to work together more effectively as a team and give the patient a coherent message? Can we organize the information in a way that it makes sense to them? I worry that the hospital looks to the patient like this king. What am I doing here? Knighting, beheading, or what? Who's in charge? How is the patient supposed to trust us if that's what they see? Then my last cartoon is, as I've said a couple of times, there are a lot of important cartoons. There are a lot of important conversations that people need to have that they're not having. And transparency is a powerful tool to use. This is, of course, about naming the elephant in the room. There are many elephants in our rooms that we're not naming. Everyone has noticed the elephant. Everyone's pretending it's not there. How do we get the confidence and the skills so we can start to name the elephants in the room and then hopefully move forward and move beyond? At the foundation of this work is the idea that when we go to work, we have work to do, but we also have relationships that are the structure within that work, within which that work takes place. So can we attend to the relationship? How do we work together more effectively so that we can get our work done? In healthcare, the stakes are huge. There are sick people who depend on us to work effectively together. And if we treat each other poorly or don't communicate well, the patients don't get the care that they deserve, and the work environment can become toxic. So we burn out and we don't have the experience that we want to have at work. So for me then, key elements of ACH culture. What makes ACH special? What makes ENRICH special? I've listed a couple here. So one is appreciation. Medicine's a little bit of an upside-down world from my perspective. I'm an oncologist, and if I see a scan that shows no illness, I describe it as negative. If it's full of cancer, I describe it as positive. For most people, those adjectives are applied backwards. We tend to look for lesions. We tend to look for problematic behavior. We tend to overlook when people are doing their job well and not calling it out. So learning to look for the best in people is something that I really see at the ENRICH course in the ACH culture. And it's been really impressive to me how when you're in a room of people who really are looking for the best in you and appreciating what you are doing, it doesn't mean that we don't also notice opportunities for improvement. But if you feel like your colleagues are looking for the best in you, it makes it much safer to work on yourself and to try to improve. If you feel attacked and criticized, the normal response is to get defensive. And when we're in a defensive posture, it's really hard to learn and it's hard to work effectively. Curiosity. I think a lot of us go into healthcare with a sense of curiosity, and sometimes it gets either beaten out of us or it fades. But if we meet each other with curiosity, if we ask each other, what don't I know yet that I need to know? What could I learn from this person that would help me? Rather than jumping to, what's the really cool idea I want to share with everyone? If we can stay in that curious space, we become more effective. First of all, if I greet you with curiosity or you greet me with curiosity, that's very welcoming. So learning to stay curious, to be less judgmental, to focus a little bit more on listening and less on talking is really, I find, for me, that's been one of the most transformative things. Thinking about the concept of invitation. We often come on in a very hard sell way with people. With patients, we want them to do something. With colleagues, we want them to agree with our plan. When we teach communication skills at my institution, we really do it in the spirit of invitation, of we have some stuff that we are offering. If you like it, great. If you don't like it, fine. But we are not pushing it. We are not selling it. We are not trying to persuade people. We are inviting them to try something. It's a much more effective approach. It's a much more welcoming atmosphere for me to learn in. I've mentioned listening before. It's striking to me as a physician how much we physicians talk. Learning to talk less and listen more, for me, is the single thing that we can do more effectively when we work with patients. And ACH works extensively on that. Empathy, I've talked about already. And transparency, I've suggested. But it's a very powerful tool to just name what's going on. And it's amazing how scary that is for people often. That there's tension in the room and no one wants to talk about it. And yet the best way to move forward and move beyond the tension is to say, it feels like there's tension in the room. It feels like our team isn't working together effectively. Just getting it out there. For me, it's like lancing an abscess. The abscesses tend to get more and more angry and painful and serious if we ignore them. If we lance them and let them drain, that's when they start to heal. Another way of breaking this down is just to think about, where do we invest our energy? Do we invest in defending ourselves, debating, arguing, persuading, which really are various power moves? Or do we invest in clarifying the agenda, listening and inquiry, staying curious, empathizing with other people's experience? It doesn't mean we agree with it, but that we recognize their experience is valid for them. We recognize their suffering if they're suffering. Trying to understand clearly. So again, curiosity and listening helps us understand better, and supporting each other. Sometimes, one of the things I think of in this work is a newspaper reporter or Sherlock Holmes. If we want to get the story, if we want to solve the case, our best tool is to stay curious, keep our eyes and ears open, and remain in a posture of inquiry rather than a posture of transmitting information. So let's talk about the course. I wanted to sort of lay out there just some of the key values and practices. And because for me, in a sense, when I go to ENRICH, and I said I've gone 5 or 6 years in a row now, when I go there, a lot of what I'm looking for is to be immersed in a world where those are the values, where everyone is trying to behave in a way that conforms with those values, and we're trying to get better at listening to each other, appreciating each other, empathizing with each other, and helping each other grow and gain more skills. It becomes, again, as I said before, much easier to work on self-improvement in an environment like that. And it's also just a more pleasant environment to be in. So let's look at the course and how it's organized. These are the course objectives. We want people to demonstrate relationship-centered communication skills for difficult conversations with patients and colleagues, describe personal awareness skills and reflective practices that will help with personal resilience in the face of challenges. We are really motivated around the issues of burnout and resilience in this setting. I'm sorry for that, the wordage there. And effectively address organizational factors that undermine relationship-centered communication and personal resilience. What are the principles behind this? So this is really learner-centered learning. We want to work on what's most relevant to you or to the people who are there. We have a variety of different offerings in terms of workshops and learning groups and things, but a lot of it comes down to what's most helpful to you or what's most urgent to you. How can we be most relevant to the learner? Because that's where we engage people most effectively. And each person generally has a better sense of what they need than we do as an organization, so we try to adapt to that. Continuity is important so that the sessions build on each other. You're in the same group every day. You're in the same workshop every day. And through that time together, relationships build and community build. There are a variety of workshop tracks. So improving patient experience with relationship-centered communication skills really looks at specifically how to communicate more effectively in clinical settings with patients. Conflict engagement is about skills for entering into and engaging in conflict in a way that gets the kinds of outcomes that we're after. Coaching and feedback through relationship reflection and intentional change is really about coaching. The teams workshop is the next one, really how do you build high-performance healthcare teams, how do we establish teams, and how do we help them grow and get stronger over time. How do we foster resilience, addressing the resilience and burnout issue. And then lastly, for the first time, we're having one on diversity, because we really see that as a big challenge in today's world of how do we have diverse groups work together effectively, and how do we talk about the diversity in a way that feels respectful and honest to everyone who is there, because we perceive a need for that, but also we think that's a high level of difficulty conversation, and for people who want to work on that, we're offering that workshop for the first time. Really, it's in response to demand. In all workshop tracks, each session builds on the previous session, so it's a total of 6 hours. And so you'll be with the same people working on the same theme, so people don't switch back and forth, for instance, between conflict and teams. You stay in the same workshop. And that way, we have a total of 6 hours, and you can get a significant amount of work done in skills practice in particular. Workshops tend to be very experiential. People don't learn well listening to other people talk. They learn best by practicing. And so that's what most of the workshops are built around, skills practice. And then the other part of ENRICH, the two main themes of the workshops and the learning groups. The workshops are closer to what you'll see at other meetings. They're very experiential, but we're not the only people doing experiential work. But the workshops are active. They're not passive listening. The learning groups are really about personal awareness. And this is important to the organization, the idea that to communicate better and have more effective relationships, we not only need to have skills, but we also need to understand ourselves better. We need to understand why we behave the way we do and why we react the way we do. What are our hot buttons? What triggers me? And what do I do when I get triggered? And can I learn skills so that I have more effective reactions and don't get hijacked? And for me, this has really been transformative work. And it's one of the things that's made me most excited about this course. In learning groups, it's really a chance to set learning goals and then to have a chance practicing skills that may address those goals. And it's very reflective, and what I have found is that I've come away with a better understanding of myself and more confidence in my ability to enter into challenging situations. One of the questions that you face if you sign up for the course, and I want to say off the bat, I recognize this is a complicated map. I'm not going to go through it. You can look at it on the slides, subsequently and go over it in more detail. But basically, we wanted to give some guidance because we have 5 different categories of learning groups. Intact team, which is basically everyone's from the same organization as you. You already know each other, and you want to work on your work together as a team. So if you're coming with a group of people from your organization and that's the experience you want to have, then an intact team is the right one. You can also come with multiple people from your organization and split up and do different groups. You don't have to be together. That's your decision. Narrative is for people who want to use writing and constructing a narrative as a way to reflect and to work on personal awareness. Case-based is a chance to describe a challenging situation that you've been in to this small group. And what happens is other members of the group have a chance to imagine this scenario from your perspective and from the perspective of the other people who are involved in it. And it's a very empathic exercise. It's similar in some ways to bailing groups, but it's basically a perspective broadening exercise that can give us a more sort of 360-degree view of challenges that we're in. That's actually what I did the first ENRICH I went to, and really found it very helpful. And it's one of the things that got me hooked on this course and kept me coming back. Leadership, if leadership issues are alive for you and you want to learn how to be a more effective leader, we offer a leadership one. Again, it's structured similar to the way a lot of the other ones are, but with a focus on leadership goals. So you would be with other people who also want to work on leadership. The methodology may be the same, but the theme may be focused on leadership. Then integrated groups is we do whatever you want. And that, in some ways, if you don't know what you want to do, I would recommend signing up for an integrated group, because that is most flexible. They're all learner-centered, but that's probably the most learner-centered. And what happens in the group really is in response to what the group needs and what the group wants. I don't think it's so critically important which group one signs up with. I try to do different ones different years. A couple of reminders. Abstract submissions are open because the ENRICH course is taking place at the same time as the research forum. The research forum is a more traditional academic type meeting where people present research and things. And you can go to ENRICH, which is more about learning about yourself and learning a new skill set, and also have an abstract at the research forum. Registration opens in January. Group discounts are available, and there's limited scholarships because we realize the cost is a barrier for people. And lastly, if you want to go to your boss or whoever has money and build a case seeking your support, we have a document on our website. So if you go to the registration page of our website for this course, you'll see a picture of this briefcase, and as you click on it, it will take you to a document that provides what we think are some compelling arguments for why they should pay for you to come. So we're hoping that that will be helpful. And that's it. I'm happy to, we can try to answer some questions or have a little bit of a discussion if possible.
Yeah, sure. Thank you, Tim. We'll give a second for people who may have questions to type them here in the chat box. While we wait, I will note that after the webinar, everybody will receive a recording of this webinar as well as the PowerPoint slides that were shared. And I will also send out the building a case document that Tim was just referring to as well in that email, so that you'll have all of the materials there. And Beth, looks like that's him.
I see a question from Beth Boynton, which you asked, is there any chance of bringing this to an institution? So yes, and contacting ACH, they don't bring exactly the ENRICH course, but these kinds of things can be brought to institutions. And Laura Cooley, I believe, is the right contact for that. Rachel, you can correct me or provide. We should be able to get you contact information.
Sure. Sure, absolutely. Looks like we have another question coming in, maybe.
So, Solange, I see your comment about nutritionists, and one of our big goals for the organization, it started off as a somewhat physician-centric organization decades ago, and it's become much more interprofessional, and we are strongly encouraging that. We want more nurses and PAs and nutritionists and psychologists and all the different kinds of people who work with patients represented in the organization and attending the meetings. So that's, you've touched on something that's a goal of ours, to become a more diverse organization. There's a question about scholarships. Rachel, can you address that, about when the information will become available?
Yeah. It'll be out in early January. Lindsay had just answered there in the chat box. Yeah. Okay. All right. Well, with an eye on time, we'll go ahead and conclude. And I would like to thank you, Tim, for leading an informative session, and thank you to everybody who will be just joined us. Just as a reminder, again, registration for ENRICH will open in January, and the abstract submission is now open, so you can find more information on our website there. That's there linked on the screen. And thank you, everybody, for joining. Hope you have a wonderful day.
Thank you. Bye-bye.